Welcome to Med Madness, the podcast that makes complex medical topics simple and easy to understand. Today we're diving into mitral regurgitation, a crucial condition for medical students and healthcare professionals to grasp. Understanding mitral regurgitation is essential because it is a common and significant cause of heart failure and morbidity in patients. In this episode, we'll cover what mitral regurgitation is, its causes, symptoms, diagnosis, and treatment options, and we'll wrap up with a real-world case study. Let's get started! Mitral regurgitation, or MR, is a condition where the mitral valve in the heart does not close properly, causing blood to flow backward from the left ventricle into the left atrium during systole. This backflow of blood can lead to various complications, including heart failure. Common causes of MR include rheumatic heart disease, myxomatous degeneration, and infective endocarditis for primary, MR secondary. MR can result from conditions like left ventricular dilation or ischemia. Understanding the pathophysiology of MR is key. It involves the mitral valve leaflets, chordae tendineae, and the left ventricular and atrial pressure dynamics. Next, let's discuss the symptoms and clinical presentation of mitral regurgitation. Patients with mitral regurgitation may present with a range of symptoms. Commonly, they experience exertional dyspnea, fatigue, and sometimes palpitations. On auscultation, a blowing holosystolic murmur is typically heard at the cardiac apex and may radiate to the left axilla. Acute MR, often due to myocardial infarction, can lead to rapid onset pulmonary edema and severe heart failure, while chronic MR presents more insidiously with gradual development of symptoms due to progressive left ventricular dilation and failure. Now let's talk about the diagnosis of mitral regurgitation. Diagnosing mitral regurgitation involves a combination of clinical examination and diagnostic tools. The primary method is echocardiography, which provides detailed images of the mitral valve structure and function. Doppler studies help in assessing the severity of regurgitation. Other important tests include chest X-rays to evaluate heart size and pulmonary congestion, and electrocardiograms to identify associated atrial fibrillation or ischemia. Cardiac MRI can be used for further anatomical and functional assessment if needed. Moving on to management and treatment. Treatment of mitral regurgitation varies based on the severity and underlying cause. Medical management includes the use of diuretics, beta blockers, and ACE inhibitors to control symptoms and prevent progression. Surgical interventions, such as mitral valve repair or replacement, are considered in severe cases, especially when there is significant symptomatic or asymptomatic left ventricular dysfunction. Lifestyle modifications, including regular exercise, a heart-healthy diet, and monitoring for complications are crucial. Preventive measures focus on controlling risk factors such as hypertension, diabetes, and prompt treatment of infections that could lead to infective endocarditis. Finally, let's look at a real-world example. A 65-year-old male with a history of myocardial infarction presents with sudden onset dyspnea and fatigue. Physical examination reveals a holosystolic murmur at the apex. Echocardiography confirms severe MR with papillary muscle rupture. The patient undergoes emergency mitral valve repair, resulting in significant improvement in symptoms and cardiac function. This case illustrates the acute presentation and critical need for timely surgical intervention in severe MR. To wrap up, we've covered the essentials of mitral regurgitation, its definition, causes, symptoms, diagnosis, and treatment options. Early diagnosis and management are vital to prevent complications and improve patient outcomes. Don't forget to engage with our pre- and post-podcast quizzes and Anki flashcards to reinforce your learning. Thank you for tuning in to Med Madness. Stay curious, stay informed, and let's change the medical education system together.